start from the last lecture was skin, eye, and CNS. We couldn't cover candidiasis. So I have removed from the presentation um, many parasitic diseases. Also, from today's lecture, I have removed some fungal diseases. Candidiasis is important because it is Candida albicans causes this. This is linked with the infections of oral cavity. That's why it's important for you. And um, so I have left this. And let's go quickly through different infections, through different pathogens causing eye infections, conjunctivitis. I'm sure you know what is it. This is inflammation corneal conjunctiva can be of either viral or bacterial origin. Very often adenoviruses that are written here below are a major cause of viral conjunctivitis, and this is very, very contagious. Also, other viruses, herpes simplex, can conjunctivitis, but major cause among viruses is adenovirus. Also, bacteria like Haemophilus can cause Haemophilus influenza, and we'll see that Haemophilus influenza can cause also pneumonia, meningitis. So this is the pathogen that can cause variety of diseases, and Haemophilus influenza type B, there are different types. It's a major cause of infections, of severe infections in children, among children. Symptoms, you see what are, so besides Haemophilus, so other microbes like Pseudomonas aeruginosa. Pseudomonas aeruginosa can reside on the skin, and Pseudomonas can cause also different diseases, wound infection. Yes, we had this in previous lecture, and Staphylococci and Streptococci. So they live on skin or respiratory tract, and then can cause different infections. And the symptoms are, you see this red eye, pinky or red eye, and it can be itchy. There can be some exudate, this is people have increased lacrimation, so production of tears, and there are eye drops for these infections. So the eye drops with antibiotics against viral conjunctivitis. We don't have specific antiviral drugs, but we can use in eye drops. Usually, there is also anti-inflammatory component, steroid component. So against adenoviruses, viral conjunctivitis. If so, antibiotic drops do not work, then we use another drops, and that soothes the inflammation, reduces inflammation, and helps to relieve from symptoms. Chlamydia trachomatis. Chlamydia are the guys, some very, very small bacteria. The rickettsia are very small bacteria. Chlamydia are very, very small bacteria. So they can go through the filters through which normal bacteria, normal size bacteria, could not go through. And chlamydia are intracellular parasites, so similar to viruses, so they go inside the cells. Also, other bacteria can be intracellular, not only chlamydia are intracellular. Yes, salmonella, for example, can go also, and many other, but chlamydia are very small and they cannot synthesize their own energy, the ATP, so they depend on cells. That's why they are obligate intracellular parasites. They should go, similar to viruses, inside their cells to cause to grow and then cause the uh, damage. And chlamydial conjunctivitis can be severe, and we see the symptoms we see on the picture, and the symptoms are listed here. Yeah, so there's as mentioned on previous slide, yeah, there's a pink or red eye, there's a discharge, so exudate from the eye, there's a swelling, crusting of lashes because this exudate dries out, and there can be also photophobia, fear of the light. So light can irritate this patient. And chlamydia trachomatis causes also genital tract infections. So babies can be infected with this pathogen while going through the birth canal. And in this case, when babies are born, usually the eye drops or eye creams are applied to prevent eye infections. Also, Neisseria gonorrhea can cause severe eye infections in newborns, leading to blindness. That's why antimicrobial eye medications, can be ointments, are used in babies. And chlamydia trachomatis can spread through water when people are swimming and can infect the eyes. And antibiotic can be used to treat tetracycline in this case. And trachoma is also caused. So this is more severe eye infection caused by chlamydia trachomas. Nowadays, this chlamydia is named chlamydophila, so I have to change in this presentation. And it causes trachoma and can lead to blindness, and it starts as a conjunctivitis, but then becomes more severe, and this is a persistent infection, and this persistent infection causes persistent inflammation, leading to scarring then. Yeah, and when scars are formed on the cornea, it can lead to blindness, and these are the symptoms of chlamydia trachoma. So quite severe clinical manifestation, and antibiotics can be used for treatment. So these were the major infections of skin and eye. Now let's move to the microbial diseases of nervous system. As mentioned, I have removed protoparasitic diseases. You can go through if you're interested, but I will not put the questions regarding those groups. It's not possible to cover everything. And so I will not discuss also anatomical details of nervous system. I'm sure you know this. We have central and peripheral nervous system as we are short in time. And let's move to the infections. So how usually, what is important to note here, there's a blood-brain barrier. So those microorganisms can lead infections of CNS that spread systemically, that do not cause localized infections, but systemic. So they spread either through blood or lymphatics or through nerves. They can also move up through retrograde transport from the peripheral nerves to the central nervous system. And we have very good blood-brain barrier, but microorganisms can cross this barrier when there's an inflammation. It increases permeability of this barrier, and microorganisms can enter the nervous system. And so microorganisms can lead to damage in spinal cord or brain, and of course, it can lead to some clinical manifestation like personality changes, dizziness, mental problems, dementia, also deafness or blindness. Um, uh, and pathogens, yes, that go through that move to the CNS, they have special characteristics. And not all bacteria or viruses or protozoans can get into the CNS and cause infection there. Now let's see some definitions. So what is meningitis? I'm sure you have heard about this and you know this. This is inflammation of meninges, membranes covering the brain. Encephalitis is the inflammation of the brain tissue, while meningoencephalitis is inflammation of both. Bacteria and viruses can cause these inflammations. And usually viral meningitis are more common compared to the bacterial meningitis, but symptomatically bacterial meningitis is more severe because bacteria produce different toxins. They have endo or exotoxins, and bacterial meningitis, to treat bacterial so symptomatically, actually, bacterial meningitis is more severe compared to viral meningitis. And different viruses or bacteria lead to meningitis. Also, viral meningitis can be complication of such infections like mumps, chickenpox, also measles, and some enteroviruses can also cause meningitis. So normally the virus presents this classic clinical, we see the classic clinical picture in chickenpox, for example, but in some patients, meningitis or encephalitis can also develop. Same with influenza. Influenza, in rare cases, can lead to encephalitis, and enteroviruses. These guys, though they firstly actually replicate, they grow in the GI tract. So enteroviruses we get through contaminated food or water, and then they grow in the GI tract, and then they move to the blood and can spread systemically and can cause encephalitis, but meningitis mainly, but it's not very severe. There can be outbreaks of viral meningitis or caused by enteroviruses. A few years ago in Georgia, in schools, we had outbreak of ecovirus. So this is one type of enterovirus, and it started in May. And many children developed meningitis, and the schools were closed. So this can be, it can impact our lives. Yeah, so this viral meningitis. Now, so what are the symptoms? Meningitis. This is stiffness of neck. So, and the patients have also pain in the neck. They have severe headache. They have photophobia, fever, and also they can be nauseated and can vomit as well. And in some cases, we have convulsions of coma. I have my personal experience from my mother. She developed meningitis around 15 years ago, and the cause was Streptococcus pneumoniae. So you see different bacteria can cause Neisseria meningitidis, Haemophilus influenza, Streptococcus pneumoniae can cause also pneumonia and otitis media, and my mother had all these three. But it was firstly she had this viral, some viral infection, not influenza. It should be some common cold virus. It was autumn, not influenza season, October. And firstly, she developed then bacterial pneumonia. Then she developed otitis media, so inflammation of the middle ear. And then bacteria moved to the meninges. And she developed meningitis. And this was Streptococcus pneumoniae. This bacterium can cause all these infections. Also, Haemophilus influenza, but Streptococcus is very, very common in causing these infections. And she even was unconscious. And I remember she had this photophobia, very severe headache. Of course, she was hospitalized. Uh, she was not really unconscious, but she was not responding to our questions properly. And then she was treated with broad range third generation cephalosporins, and luckily she recovered. And some minor surgery was done. There was a fluid accumulated in some cavity behind the ear, and this fluid was removed. This fluid probably was pressing on the brain, and so she was undergoing this some surgery, and then these antibiotics worked well. It was a huge, I'm sorry, shock for me to see how sick was my mother. And when there's a meningitis, the lumbar puncture is done. So this was done also with my mother, and this cerebrospinal fluid is checked then for presence of white blood cells, and yeah, usually in case of bacterial meningitis, this cerebrospinal fluid is turbid, more turbid, while in viral meningitis, this is clear. So, and there are other parameters also um, to draw some conclusions, yeah, when studying the cerebrospinal fluid content, the glucose, protein content, and so there are also other parameters. And so when there is uh, in case of bacterial meningitis, when the cerebrospinal fluid is obtained, the sample is can be stained using gram stain, and one may see if it is a Neisseria meningitidis. These are gram-negative cocci or cocci. We name cocci, but sometimes in English, uh, it's also named as pronounced as cocci. So they are diplococci. Two cells are attached to each other. If it's a Streptococcus pneumoniae, these are chains of the gram-positive cocci. So gram stain can give us some information, and also we can culture microorganisms from the cerebrospinal fluid under laboratory conditions, then identify them, and we can do also serological tests to identify the causative agent. And usually chemotherapy, so antibiotic therapies initiated before pathogen identification because it's a severe case. So disease can progress and can be fatal. Meningitis, especially bacterial, it's very, very serious. And broad spectrum third generation cephalosporins can be used. Yes, so also in case of my mother, third generation cephalosporins, rodsepin, ceftriaxone specifically, was used. On picture, what we see here, gram stain of cerebrospinal fluid, these are gram-negative diplococci. We see the cells in pairs, and this should be Neisseria meningitidis. Now, tetanus. um, is caused by Clostridium tetani, and it was a deadly disease in the past, especially during the war. Many soldiers developed this tetanus. This is spastic paralysis of the muscles, and it was deadly because it led to the paralysis of chest muscles that and diaphragm that blocked the breathing, that interfered with breathing, and also there was a cardiac failure, and people were dying. So tetanus is caused by this bacterium Clostridium tetani. Now this guy forms spores, and spores are very, very resistant in the environment, and they can be found in soil, also in animal feces, and can contaminate the wound. So when we have the cut on the skin and this wound is contaminated with the soil, we have chances to develop tetanus. But luckily, we're vaccinated in childhood. But of course, this immunity wanes with the time. But mainly, children are playing, in the soil and in the sand. They like to play there, so they are more under the risk. And this guy, Clostridium tetani, grows in the wound locally, the damaged area, and produces neurotoxin, tetanospasmin. This neurotoxin enters the neurons and moves to the CNS as well, and it blocks contraction of the muscle. So the neurons cannot release the mediator in the synapses between the neurons and the muscles. So neurotransmitter is not released, and it results to paralysis. The muscles cannot relax, and it leads to spastic paralysis. And in the treatment, we use the tetanus immunoglobulin. So this is antibodies against the toxin. This is actually antitoxin. And we have also vaccine, and it is in together with the diphtheria, tetanus, and pertussis, DTP vaccine, and children get this already in first year of their life. And we also get tetanus vaccine when we're bitten by the animal, for example, because together with the rabies vaccine, we also get this tetanus vaccine, because if dog bites us, very often dogs have dirty mouth, contaminated with soil or other things. So usually tetanus is applied together with the tetanus vaccine, together with the rabies vaccine. So this is the classic condition of a person with tetanus. So all muscles contract and cannot relax, and this is the spastic paralysis. Botulism, very important disease, and it is related with consumption of the home canned food. So very often, my mother also in the past used to can some vegetables for winter. Now not, but in the past, yes, like beans or aubergines or whatever, and it is quite risky. And why? Because Clostridium botulinum, this is also Clostridium, this is also endospore forming bacterium, can contaminate these vegetables. And when we boil these vegetables, spores usually don't die. And when we can this food, This Clostridium botulinum wakes up in the can and produces exotoxin. So it is released from the cell of the bacterium, and it also is neurotoxin. And it, what does it do? It also blocks release of neurotransmitter acetylcholine, and it blocks then contraction of muscles. So this is opposite to tetanus toxin, and it leads to flaccid paralysis. So muscles are relaxed and do not contract. And of course, it can also lead to respiratory or cardiac failure and can be deadly. It has, if untreated, it has very high mortality rate. And how can we prevent botulism? If we have home canned food, we should boil it for 20 minutes, at least for 20 minutes, or we should pasteurize the products, the non-home, so this kind of food that is made in some food factories. Of course, they use this pasteurization and they kill these spores in food. And so mainly pasteurization is done. So this food is safe, but homemade canned food is not safe. And nitrates can also prevent endospore germination in sausages. So sausages, especially homemade ones, can contain this botulinum toxin. And when you check the content of sausages, you will see very often this nitrates, presence of nitrates. So it is used to prevent endospore germination. And botulinum toxin doesn't like acidic foods like pickles. It likes slightly alkaline, neutral to alkaline. And also babies can develop baby botulism. This is when they consume Clostridium botulinum, not toxin, but bacterium, and bacterium grows in the GI tract and can produce toxin, and then it leads to floppy baby syndrome. So baby is weakened because of this muscle weakness. And the main source of this Clostridium botulinum in babies can be honey. That's why honey shouldn't be given to babies under 1 year of age. So how can we treat? So some people got intoxicated with the botulinum toxin, and we can give antitoxins. Of course, fluids are given. Transfusions can be made of fluids, antitoxin. Yeah, so in horses, antitoxin is developed. So this is actually antibodies against this neurotoxin and can be given to the patients, but there's a risk of anaphylaxis. Yeah, we know from the immunology course. So human immunoglobulin will be safer, of course. Now, viral infections of CNS, poliomyelitis, polio caused by the poliovirus, and poliomyelitis was a huge problem in the past. But nowadays, we have very successful vaccination program, and in the developed countries, there are also no poliomyelitis disease. There was a few vaccine-associated poliomyelitis, and but in general, developed countries are free of poliovirus infections. And we see polio infections in a few countries like Pakistan, Afghanistan, Ethiopia, as I remember. And we have, and what is the symptom of polio? I will briefly describe poliovirus. infects humans through fecal oral route when we drink water or when we eat contaminated food. And poliovirus firstly replicates, so multiplies in the GI tract, and then moves to the blood and infects also peripheral nerves and goes to the CNS. And actually, poliovirus infects motor neurons, anterior horn of the spinal cord, and it kills these motor neurons, and the paralysis develops. Yeah, it doesn't mean that all poliovirus infections really leads to paralysis. Majority of infections are asymptomatic. There can be other symptoms as well. But in the past, so polio was infected a huge portion of human population. So, and also many people developed this paralytic polio, and they had problems with walking, they had problems with bone development, and many people remained in wheelchairs, where some people had one leg shorter than another. So the muscle atrophy developed, and it led to problems, of course. And we have two vaccines. One is inactivated, killed vaccine, another is live attenuated vaccine. In developed countries nowadays, only inactivated vaccine is used because live attenuated vaccine can revert to the virulent wild type and can cause paralytic polio in some vaccinated individuals. So that's why this is withdrawn in Western, so in developed countries. So rabies, very important viral disease. So I have to go faster. I will try. So rabies, yeah, this is disease of mammals, and potentially all mammals can carry this rabies virus that can be infected with the rabies virus, and animals sometimes become furious and they want to bite more people or other animals to spread. And there's also paralytic rabies when animals are more confused and unaware of surroundings. So how can we, the main target of the rabies virus is the CNS, and it leads to development of deadly uh, encephalitis. And in animals and also in humans, rabies is found in salivary glands, can be found in eye as well, in cornea, um, and rarely in blood, and can be found in other organs as well. So how people develop rabies? When the dogs bite us, at the dog or other animal, at the site of bite, virus starts to multiply, replicate, and then it enters the nerves, peripheral nerves, and then moves to the CNS and causes encephalitis. And you may know the symptoms of rabies. Here we have, firstly, we have this fever, sore throat, some undifferentiated febrile symptoms. Then people develop CNS symptoms, some bizarre behavior, photophobia. There's also hydrophobia because people, also animals, are scared of water. They cannot drink water because they have painful muscle spasms. And then seizures develop, seizure and coma and death. And we can prevent rabies. So people who have constantly have contact with animals, they should be vaccinated once in every 2 years, and 3 doses of vaccines are given. So laboratory workers, animal handlers, veterinarians, they should be vaccinated. And this is pre-exposure prophylaxis. And there's a post-exposure treatment. When we're bitten by the animal, we should get vaccine. And there are 4 or sometimes 5 doses. On 28th day, fifth dose can be also given. So rabies immunoglobulin together with the rabies vaccine is given. And rabies immunoglobulin is given close to the bite side, so the antibodies could neutralize the incoming virus. And rabies vaccine is given to the distant side from the bite. And as rabies has long incubation period, can be 1 month or even 6 months, vaccine has time. We have time to develop the immune response to the rabies vaccine. And of course, when some animal bites us, we should clean with antiseptic. First, we can wash with the water and soap, and then we can use antiseptics to kill viruses that contaminate the wound. Uh, yeah. So, and there are a few interesting cases how several people were treated using Malbuki's protocol and they were saved. So, unfortunately, we don't have time to discuss this protocol now. But there were a few cases where people who developed symptoms of rabies were saved and recovered from rabies. And also many viruses that are transmitted through arthropods, arboviruses, can lead to encephalitis. And these are some examples. I will not go into the detail. We don't have time. So Culex or Aedes mosquitoes can transmit the viruses, Western equine, Eastern equine, Central. I will not ask you for this, but just for you to know. Yeah, so many arboviruses can transmit encephalitis viruses. This West Nile virus is more widespread. It first started in Africa and then spread throughout the world. Culex mosquito transmits this, so virus enters the blood during the bite and moves to the CNS and causes encephalitis. And in different viruses, we have different mortality rates. In some can be quite high. And these are the guy, Culex mosquito can transmit encephalitis. And briefly about spongiform encephalopathies, very interesting agents. These are prions. They're neither bacteria nor viruses. They're just proteins, and these are fibrils of these proteins, and they lead to neurodegenerative diseases of CNS. And these are the holes. The neurons die in the brain, and due to this prion infection, and the holes are left in the brain tissue. That's why the name spongiform encephalopathies. And I will tell you the UK story about transmissible spongiform encephalopathies. So firstly, it can lead to the disease in animals as well as in humans. And how protein can cause the disease, that is surprising. And prion, this is abbreviation from proteinaceous infectious particle. We have these prion particles, proteins on the plasma membrane of our neurons. So it has its own function involved in signal transduction within the cell, and can have also other functions, but it's not well known. This is normal prion protein. I think I have this slide. Yeah. So PRPC, this is a cell, yeah? And on the surface, we have this normal PRPC neurons. And what happens when the disease and abnormal protein is named PRPSC. SC stands for scrappy. Let's check it. Sheep scrappy. Yeah, because sheep infected with this virus were scraping their backs against the wall, so they had some strange behavior. This abnormal, you see it is here, interacts with the normal PRPC and makes it abnormal. I'm sure you have you have seen the movie Matrix when Mr. Smith is making all all other people Mr. Smiths. Yeah, so same is with this prion. So abnormal interacts with the normal, and this normal becomes a diseased, and then these two can interact with the normal ones. You see here, and they also become abnormal, and then this presence of abnormal prion proteins leads to apoptosis of neurons. Apoptosis, so programmed cell death is switched on, and the neurons die. So how can we get these prions? Abnormal prion proteins. One is through mutation, so it can be genetic reason. Some mutation happens in the gene encoding prion protein, then it changes the conformation and becomes abnormal. Another way is infectious. And what is it? If we consume some products from the animal that has this prion infection, we can get infected with this protein. So protein gets into the GI tract, then moves to the blood and moves to the CNS and starts to interact with the normal prion proteins on our neurons. And this is long-lasting. Actually, incubation period is long-lasting, can be 20, 25 years. And then when the disease starts, it shows dementia, ataxia, so a problem with speaking, problems with walking and coordination, mental changes, and then it leads to death. There's no treatment for this disease. And in 1990s, there was a huge outbreak of prion diseases in farms in UK. And maybe you have heard about the mad cow disease, because the cows were given the feed that was prepared from sheep and also cows, or that were contaminated with the prions. And there was a huge outbreak leading to huge economical losses, and people got infected because sausages were prepared from those cows before knowing that cows were infected with the prions. Yeah, and the sausages served as a main source. And actually, people who lived in UK in the 1990s, and if these people then later move to the US and they donate blood, their blood is tested for a prion content, prion protein content, because potentially they can have these prion proteins in their blood. So these prions are very, very interesting agents, and they are not killed by boiling or chemicals, disinfectants. They have different conformation. Normal prion protein has alpha helical structure, while the diseased abnormal protein has plated sheet, beta plated sheet conformation. So amino acid sequence is mainly the same. If there's a mutation, there can be change in one or two amino acids, and already it can lead to these conformational changes in this protein and can lead to disease development, of course. But primary structure is almost the same. And we see the difference in conformation, and this beta-plated sheet conformation confers high resistance of these prions to boiling and some disinfectants or whatever. So they are very interesting infectious agents. They were not so long ago described, starting from 80s. Okay, guys, let's have a break now, and then I will start a new topic: infections of the cardiovascular system, lymphatic system, and respiratory tract. I hope to manage within an hour. So see you in around 10 minutes. Okay?
Okay, thank you.
Okay. See you. Okay, I'm back. Now let's go through the diseases of cardiovascular and lymphatic systems, and then we'll go through infections of respiratory system. Um, are you here, guys? I will start, okay? So, because we're short in
Okay.
time. Okay. So again, I will not go through these parts of cardiovascular system or lymphatic system. Lymphatic system we have discussed in frames of immunology course. Yeah, yeah, in this part of our course. So the cardiovascular system consists of heart, blood, and blood vessels. This is very simple. We know information about the lymphatic system. And we also should go through some definitions and see what is septicemia. Septicemia is when microorganism is in the blood, persists in the blood, and other toxins. This is septicemia. We have also other definitions like bacteremia, when bacteria are in the blood, but they don't persist there. Bacteria move to the blood and then can move to other tissues and organs, but they don't persist and don't multiply in the blood. We have also viremia when virus is in the blood and reaches then the target organ. Septicemia when pathogens persist in the blood, may grow there, may multiply there, or their toxins, especially bacteria. Bacteria produce the toxins. This is septicemia. So when microorganisms get into the blood, it is very bad, pathogenic. There are some other bacteria that don't cause disease. We have some microbial flora of the blood. Um, some pseudomonas or other bacteria can circulate and or uh, but they don't cause too much harm. But we're talking about pathogens. So what is sepsis? This is systemic inflammatory response. Also, in case of coronavirus infection, we have the sepsis and septic shock. When there is a systemic inflammatory response, very often here we have this abnormal immune response leading to inflammation, systemic inflammation, leading to vasodilation, leading to increased permeability of the blood vessels. It leads to the drop in the blood pressure. So severe sepsis, the systemic inflammatory response, becomes severe when we have also decreased blood pressure, and a septic shock when there's a sepsis but blood pressure is also uncontrollable. Fluids are given, everything, the treatment is done to increase the blood pressure. Medications are given, but it doesn't help, and it leads to multi-organ failure because the organs are not supplied with the blood and oxygen properly, and there can be one organ failure, can be several organ failure, and it leads to death. Yes, and this can be case also in case for coronavirus as well. And very often people who have this sepsis, they show lymphangitis, and these are inflamed lymph vessels. And we see these inflamed vessels, lymphangitis, yeah, of the through reddening on the skin. This is inflammation of the lymph vessels. So, um, sepsis can be caused by bacteria and or viruses as well, and either gram-positive or gram-negative bacteria can lead to sepsis. and it has very high mortality rate. Mortality rate is around 25%. So you see it is very quite high. And gram positives can cause sepsis like staphylococci, group B streptococci, for example, Streptococcus agalactiae, leads to neonatal sepsis, enterococci as well. And what are these nosocomial infections? These are hospital-acquired infections, and the microbes that are in hospitals are very nasty. They are, majority of them are antibiotic resistant, and it's difficult to treat them. So staphylococcus can get many people have in the respiratory, upper respiratory tract, the skin, the staphylococci, but in hospital environments, clinics, so staphylococci can contaminate some surfaces, can contaminate some instruments, and there the people in hospitals are immune suppressed, and staphylococcus can spread, can lead to systemic spread, can infect those people, can spread systemically, can go to blood and lead to sepsis. And among group B streptococcus, we have the Streptococcus agalactiae. It leads to neonatal sepsis. Mothers, pregnant women, very often have the Streptococcus agalactiae in genital area, in genital tract, and it may lead to neonatal sepsis in newborns, in newborn babies. So very often, not always, but yes, always actually, routinely, the pregnant women are checked for Streptococcus agalactiae. And when they are pregnant, and if they have this Streptococcus agalactiae, they should get treatment. Also, Enterococcus faecium, Enterococcus fecalis, these are guys that live in GI tract and are released with the feces, but they uh, can contaminate the skin, they can get on the skin, and in hospital environments, they can lead to wound infections and can spread systemically and can cause heart infections as well, and also they can lead to sepsis as well. Childbirth fever, puerperal sepsis, is caused by Streptococcus pyogenes, and it is nowadays very rare. This is the sepsis in birth-giving mothers. Yeah, so the lady had labor, but then physician or midwives didn't wash hands well, and they had streptococcus contamination, and they can infect this mother, and it leads to severe sepsis. And actually, in the past, it was very common and led to high mortality in birth-giving mothers, up to 25% in some cases. But later, with the improvement of sanitary conditions, people became aware that the washing hands is important, especially if you are medical personnel and you have to handle the patients, and then the cases decreased significantly. This is gram-positive cocci, so blood can be tested for presence and stained to check which bacteria causes the sepsis. And gram-negative sepsis is very severe because gram-negatives have endotoxins in their cell wall. This is lipid A, and mainly playing important role. Endotoxin is cell wall component. We have peptidoglycan, yeah, in bacteria. In gram positives, this is thick. In gram negatives, this is thin. And in addition, gram negatives have lipopolysaccharides that have this endotoxic activity. Yeah, so here's written lipopolysaccharide, and they are released when cells die. Of course, when cells, bacterial cells grow in our body, some die, some continue to grow, and endotoxins are released, and they can lead to endotoxin shock. It can lead to leukopenia, decreased leukocyte count, can lead to disseminated intravascular coagulation. It leads to coagulopathy and coagulation of the blood in internal organs of the skin. It is very bad sign. Um, and of course, there is a inflammation, as mentioned, a drop of the uh, hypotension, yeah, blood pressure drop, and multi-organ failure. And in case of gram negatives, endotoxins are involved in sepsis development. But which component in gram positives play a role in sepsis development is not well understood. They have gram positives have this teichoic acid and other structures. Probably these structures are involved in development of sepsis and septic shock. And bacteria can cause heart infection. Also, viruses can cause myocarditis or pericarditis. And what is endocarditis? This is inflammation of the endocardium, um, and can be caused by bacteria, streptococci, for example, or also by Staphylococcus aureus, and subacute bacterial endocarditis. These are caused by alpha hemolytic streptococci from mouse. So this is important. You should remember this. And acute bacterial endocarditis caused by Staphylococcus aureus from mouse. And what happens in this case when dentist removes this bacteria leave some viridans group of streptococci, alpha hemolytic streptococci. We'll discuss them in detail, of course, in nearest future. So they live in the oral cavity. Alpha hemolytic streptococci, staphylococcus lives in the respiratory tract, also in oral cavity. And when dentist removes the tooth, or conducts some surgical manipulation, these streptococci or staphylococcus aureus can move to the blood and then can move to the heart and cause endocarditis. But especially in people who have some problems with the valves, who already have some inflammation there, if there is a aggregation of fibrin platelets. So this is the normal appearance, and this is example of endocarditis. So bacteria start to attach if the people have these abnormal valves, and the bacteria start to colonize and then induce this inflammation of endocardium that leads to endocarditis and can be deadly. And streptococci can cause also pericarditis. This is inflammation of um, sac that covers the heart, membranes that cover the heart, can be caused by streptococci. And streptococci can lead also to the rheumatic fever. This is inflammation of the heart valves. This is autoimmune disorder. So when people have Streptococcus pyogenes infection, when they have sore throat and or scarlet fever, some surface components of Streptococcus resembles antigenically those of the heart valves, heart tissue proteins. And when immune response develops against Streptococcus, it also starts to attack heart valves. And of course, leads to inflammation. And the rheumatic fever is also outcome of the streptococcal infection, and we see the inflammation of the joints, and this is nodule developed as a result of rheumatic fever. This is also autoimmune disorder. So Brucella is the guy. It is also a nasty guy, not very common, I would nowadays, but can be easily spread if we drink unpasteurized milk. Brucella infects animals. This is a zoonotic bacteria, and in different animals, we see different Brucella species. Brucella abortus in elk, bison, cows, suis in swine, militans, goats, sheep, camels, and Brucella can lead to chronic infection. Brucella spreads in reticuloendothelial system and can lead to undulating fever. So each evening, person develops this fever up to 40. And it can lead to chronic disease, and it can be treated with the antibiotics. Anthrax, we have anthrax cases in Georgia. This is quite severe, deadly disease, and we have annually 30, 40 cases of anthrax in Georgia. And maybe you have heard about some terrorist attack in US in 2001. I don't know maybe you were children or were not born at all. I don't know your age, but in 2001, the envelopes containing anthrax spores were sent uh, to some people in U.S. government, and people actually got infected, and around 50% died because they developed inhalatory anthrax. This is deadly. It has high mortality rate, and anthrax is caused by Bacillus anthracis, and it is considered as a bioterrorist agent. So, as it causes severe disease with high mortality rates, it can be considered as a bioterrorist agent. So it causes, we have different types of anthrax. We have cutaneous affecting skin. The Bacillus anthracis is found in cattle, in soil as well. It is also spore forming. And when people at slaughterhouses work, so they cut the meat or whatever, they process this meat, they can be infected, the skin can be infected with Bacillus anthracis if they have some cuts on the skin. But usually we have some cuts, and the bacterium enters the skin and multiplies, so grows locally, and produces specific dark black scar, black eschar. This is ulcer. And if this bacterium spreads systemically, it can lead to 20% of mortality. And gastrointestinal anthrax is more nasty, so it has high mortality rate if person consumes undercooked food that is contaminated with the Bacillus anthracis spores or bacteria, mainly spores, and it leads to ascites, accumulation of the fluid in the abdominal cavity, bloody diarrhea. So it is a very dangerous disease. And inhaled pulmonary anthrax is the most dangerous because if untreated, here we have 100% mortality. In US, people were treated and still 50% have died. And when people inhale the endospores, the Bacillus anthracis infects macrophages. That's why it is discussed here in the diseases of cardiovascular and lymphatic system. And through macrophages, it spreads to different parts of the body. It moves to the endostenium, and causes inflammation, it causes pulmonary edema. It produces three types of toxins, so I will not go into the detail. Unfortunately, we don't have time. It has a capsule of protein, so very different from other capsules that have polysaccharide. Actually, the component is polysaccharide, but anthracis, anthracis has this protein capsule produces three toxins, and that's why it can cause this severe disease. Plague, yeah, you have heard about plague. Many people in the past were dying of plague, and reservoir of the plague are mainly the rodents, rats, prairie dogs, other rodents, and how humans get infected through fleas. These rodents have fleas. How in Europe the plague was spread? There were rats in cities or towns, and these rats uh, and there were poor sanitary conditions. Yeah, so people were bitten by the flea and they got infected with this plague. Yersinia pestis is a causative agent, and we have different types of plague. Bubonic plague, when bacteria grow in the blood and lymph, and buboes develop, these nodules. There are also septicemia plague when septic shock develops and the people die, and pneumonic plague when bacteria affect lungs. And in this case, human to human transmission is also possible through coughing or through respiratory droplets. But nowadays, we don't have plague, and it is also called as Black Death. Yeah, because people develop the hemorrhages of the skin, black hemorrhages. So there was a bleeding, but had this black color. So that's why the Black Death. Now, the viral diseases of lymphatic system, infectious mononucleosis. This is very common disease, and it can be caused either by Epstein-Barr virus or cytomegalovirus. And the majority of infections are asymptomatic, but Epstein-Barr virus is also named a kissing virus because it is transmitted exclusively through saliva. Kissing and Epstein-Barr virus targets B lymphocytes and also epithelial cells, and leads to this infectious mononucleosis. And what are the symptoms of infectious mononucleosis? Nothing special. Fever, sore throat, lymphadenopathy, and can be also hepatosplenomegaly due to this production of lymphocytes, B and T lymphocytes. So Epstein-Barr virus infection is very, very common. Up to 80% of population or higher can be infected. And in fact, Epstein-Barr virus can also cause cancers. And one example is Burkitt's lymphoma. It is more common in Africa, in children, in boys, and in immunosuppressed as well. But this Burkitt's lymphoma can be treated with chemotherapy successfully. We don't have any antiviral treatment. We cannot treat virus specifically. Cytomegalovirus can also cause infectious mononucleosis, but majority of infectious mononucleosis cases are caused by the Epstein-Barr virus, 85%, and 15% by cytomegalovirus. It is also a widespread virus. But cytomegalovirus can be transmitted from mother to child transplacentally, through kissing, through sexual intercourse, through breastfeeding, through blood transfusion. So the cytomegalovirus is also very successful pathogen. And you see age percent of population with antibodies to Epstein-Barr virus, cytomegalovirus, this is toxoplasmosis, this is parasitic disease. I have excluded from the presentation. So, and with the age, you see the people over 50 years of age, majority of them have antibodies to Epstein-Barr virus and cytomegalovirus. So they were infected in their lifetime with this virus. Malaria, let's discuss briefly. We have several species. Here are given four. Plasmodium, this is protozoan. I did not exclude it from the presentation, malaria, because it is very important pathogen and it grows in the red blood cells, it grows in the liver. But just briefly, let's discuss these guys and these three, Plasmodium vivax, ovale, and malaria, cause relatively benign malaria, while falciparum is most dangerous and it has very high mortality rate. And it is transmitted by mosquitoes, Anopheles mosquitoes. In past, till the beginning of 20th century, we also had malaria in the West Georgia because this vector is distributed in Georgia as well, Anopheles mosquitoes. But mosquitoes breed in the swamps, in the ponds, and then in the beginning of 20th century, the swamps were dried out, and also gambusia is the fish that feeds on the insect larvae and mosquito larvae. It was also introduced in the swamps. So nowadays we don't have malaria in Georgia. And what are the major symptoms of malaria? What is the specific symptom of malaria? These are paroxysmal chills and fever. And so person feels okay for 2 3 days, then suddenly is a chilling, then fever goes up, then fever drops. Person feels also okay. Then after 2 3 days, again the fever goes up. With a falciparum, it's almost continuous fever, and these chills and fever depend on what? This Plasmodium parasite at the same time infects the erythrocytes. Then at the same time, erythrocytes rupture, and then it's a shock. Yeah, so it leads to fever and these symptoms. Then is this relief phase. Yeah. Then again, these parasites infect erythrocytes, then rupture, and it leads to fever. Yeah. And we have vomiting, also headache, can be jaundice and hepatomegaly due to involvement of the liver. And it is quite severe disease. You see up to 500,000 people can die only in Africa, and Africa suffers the most. So we have millions of cases and many deaths. And how can we prevent? Nowadays we have vaccine. In a book, in your textbook, even in the new one, they don't mention anything about, they mention that vaccine is under development and so on, but actually vaccine exists, and this is not so effective vaccine. Yeah, so it is a problem to develop this, but it is approved, FDA approved vaccine, and it has some effectiveness. People develop milder disease, and last year I met one lady from Switzerland who was involved in vaccine development against malaria, and we talked about these details. Yeah, it's interesting when you contribute to some work that can save the lives. Yeah, it's quite exciting. And tell people to go who go to endemic areas should take some medications for prophylaxis. There are different medications that are mentioned here, and some have very severe side effects. Even when people stop taking these medications, can lead to some psychological changes. But it is still important to take tetracycline. So antibiotics can be also taken to prevent the malaria. Uh, as a treatment, artemisins can be used, chloroquine can be used as well, and for control. And what is written in the textbook that there's not much interest to develop anti-malarial drugs because it is not profitable for the companies. As malaria affects mainly Africa, people there cannot afford expensive drugs. Can you imagine? And therefore, companies are not interested to develop effective medications against malaria. Yeah, it's not so human thinking, but yeah, so economic profit is very important, probably. Yeah, so leishmania, yeah, I did not exclude this from the lecture. Leishmania is also quite widespread in tropical and subtropical areas, and actually we have leishmaniasis in Georgia as well. And reservoirs are the animals like dogs, stray dogs, and Phlebotomus sandfly transmits this leishmania to humans, and it can lead to skin lesions. This is milder form. This is cutaneous leishmaniasis. There's also mucocutaneous leishmaniasis that affects deeper layers and skin um, and mucous membranes and can lead to disfiguring of the face. And the most severe form is this Kala-Azar visceral leishmaniasis that involves visceral organs, spleen, liver, and leads to hepatosplenomegaly. Um, and it can be quite deadly if untreated. So this guy, Leishmania, infects mononuclear cells and phagocytes. That's why it is included under this section. So it was, these were the pathogens related to cardiovascular and lymphatic system, now respiratory system pathogen. So too much material to cover. So I will not go through again parts of the respiratory tract. So anatomical description of anatomy of respiratory tract. I have removed those slides. So respiratory infections are very, very common. Can be either bacterial or viral. Viral respiratory infections are more common than bacterial ones. And viral respiratory infections are very common because with the respiratory tract, we have contact with the outside environment and the microorganisms that are transmitted through droplets or aerosols can attack our respiratory tract. And we have normal microbiota in the respiratory system, but some members of normal microbiota can lead to disease. Again, Streptococcus pneumoniae, Staphylococcus aureus, Haemophilus influenza, Neisseria meningitidis can be found as the normal components of the can reside and live the upper respiratory tract, but in some people can cause the disease. Again, some definitions. What is pharyngitis? Well, what we call the sore throat. Yeah, this is pharyngitis. What is laryngitis? Sometimes when we have the sore throat, we cannot talk. We have no voice is coming out. This is due to inflammation of the larynx. This is laryngitis. What is tonsillitis? Inflammation of the tonsil. Other nodes that we have. Sinusitis. This is inflammation of sinuses that we have in the behind the nose and behind the front bone. Yeah, so here, so inflammation of sinuses, epiglottitis, inflammation of epiglottis, This is the some structure that covers the larynx uh, when we swallow, and if the epiglottitis can be deadly because it can interfere with the breathing. If there's inflammation of epiglottis, it is swollen, reddened, and it can be caused by Haemophilus influenza. And streptococcal sore throat is very common. We have discussed the Streptococcus pyogenes or no other type of Streptococcus pyogenes is a group A Streptococcus, and it has some virulence factors. We see here streptokinase. This it helps to spread this bacterium when there's the blood clots. Blood clots trap the bacteria. That bacteria can lyse these blood clots and move further. Streptolysine it lyses red blood cells and leukocytes. And streptococcal pharyngitis is the most common bacterial manifestation of respiratory tract infections. And we can see here, so we have sore throat, we see the red threatening and the inflammation of the throat. The complications can be tonsillitis. Bacteria can move to the middle ear and cause otitis media. And we see enlarged lymph nodes in the neck. And we can diagnose this quite easily. There are rapid tests, we can culture bacteria. And of course, in this case, treatment is we have plenty antibiotics. So this is streptococcal sore throat. And some streptococcal strains, streptococcal pyogenes strains can produce a very potent toxin. This is erythrogenic toxin that can spread systemically and have systemic effect. And in this case, people develop skin rash. This is scarlet fever, and it is a quite severe condition. It has very high fever and toxin affects the mood and can be quite severe, quite commonly found among children. So there's a streptococcal sore throat plus these symptoms. Yeah, scarlet fever includes this rash. Also, this tongue has strawberry-like appearance, is spotted, and strawberry-like appearance, like the surface of the strawberry reddened, and yeah, this uh, more rough. Yeah, and today we have not so many cases of scarlet fever. This is the scarlet fever, and viral infections lead to rashes as well, so it shouldn't be confused. Diphtheria, very life-threatening condition caused by Corynebacterium diphtheria. This is also transmitted by the respiratory tract, and Corynebacterium diphtheria produces different toxins. These are the guys. They have this shape, bulb-shaped appearance, and this Corynebacteria produce some toxins. And why? So it affects respiratory tract, grows there in epithelial cells, invade epithelial cells and produce toxins that have the systemic effect. And what is the problem here? Corynebacterium can form some grayish, whitish membrane on the that can cover the airways and can lead to death. In the past, it was a huge problem, but nowadays we have vaccine and we can use antibiotics to treat, so it's not a huge problem anymore. And this toxin that is produced by this bacteria can circulate in the blood and can affect the heart and kidneys as well. And this is the membrane on tonsils. You see this whitish grayish membrane that consists of dead cells, of fibrin, of bacterial cells, and it was the life-threatening condition in the past. So we see the swollen lymph nodes here, and we can prevent diphtheria through vaccination. We have vaccine. Vaccine is given to children, and this is toxoid actually. No, we have also toxoid. Yeah, toxoid is in the vaccine, but we have also antitoxin. These are antibodies to the toxin. This is for treatment, and we can use also antibiotics, and that blocks bacterial growth. And of course, antibiotics cannot neutralize the toxin, but it blocks and inhibits growth of bacteria. And we use antitoxin for therapy, also to neutralize the toxin with antibiotics. Otitis media is the inflammation of the middle ear, and it is a very common condition, especially among children. I remember one of my children, younger one, developed very often this otitis media after bacterial infections because due to anatomical peculiarities of children. Yeah, so um, uh, the bacteria can reach quite easily from the respiratory tract to the otitis to the middle ear and can inflammation. Also, there are viral infections, and these are the bacteria that usually cause otitis media, very often Streptococcus pneumoniae. Haemophilus, Moraxella, so Streptococcus pyogenes, Staph aureus, and viral infections. Respiratory syncytial virus can lead to otitis media. Influenza virus can also lead to otitis media. And yeah, how can we treat using the antibiotics? My child was given amoxicillin, as I remember, when they developed otitis media. So it is very frequent in childhood, and it leads to swelling and bulging of the eardrum, and it is very painful. But antibiotics are usually effective, and this pain is also relieved then. I was giving also pain relievers to children and also antibiotics, and then they could recover. So viral diseases of respiratory tract, very common. Yeah, common colds are caused by many viruses. Common colds are mild condition, mild respiratory illness with the runny nose, cough, can be sore throat, fever is quite rare. And there are many viruses like adenovirus, rhinovirus, coronaviruses can cause common colds. Um, Enteroviruses can also cause common colds. Yeah, there are huge variety of viruses causing common colds, so it's not a life-threatening condition, and we usually don't develop immunity to common cold viruses because there are many types of common cold viruses, and we use symptomatic treatment. Yeah, so symptoms, you know what they have, and common colds are transmitted through respiratory droplets. Yeah, and in some cases, for example, respiratory syncytial virus or parainfluenza, some viruses can lead to complications like otitis media, yeah, and can lead to pneumonia or bronchitis. So they can move to the lower respiratory tract, especially in children. So we use symptomatic treatment, and the recovery is within a few days. Yeah, so we're usually not doing so bad. The running nose, sore throat can be disturbing, but we usually recover less than a week, maybe 4 or 5 days. So lower respiratory system diseases can be caused by different microorganisms, bacteria, viruses, or fungi, and which diseases are included here: bronchitis, bronchiolitis, when we have inflammation of bronchioles or bronchi, and pneumonia, when alveoli become inflamed. And tuberculosis, so you have heard about this, quite severe disease, whooping cough, bacterial pneumonia can be the severe psittacosis. These are caused by the chlamydophila and can be transmitted by the from parrots. Just briefly about the whooping cough, and then let's finalize, finish our lecture. Bordetella pertussis. Or do you have the lecture in 10 minutes?
No, I don't.
No?
No, I don't.
Okay, just a few minutes and then we can finish our lecture. Let's finish Bordetella pertussis and then I will continue next week. Though I have removed many, some pathogens, yeah, too much to cover. Bordetella pertussis, it is a causative agent of whooping cough. Uh, so this is cough-like barking, and it is caused by this gram-negative bacterium, and it infects the respiratory tract and attaches to the ciliary epithelium and produces toxins and blocks the action of the ciliary epithelium, so that it has several toxins, many toxins, but two are mentioned here: tracheal toxin damages the ciliary epithelium. We have pertussis toxin that has systemic effect. It moves to blood and we feel bad. It has a systemic influence. And pertussis, when the ciliary epithelial cells die, the mucus accumulates, start to we want to remove this mucus through coughing, and children have this whooping cough. They cannot cough off well this mucus because these epithelial cells are damaged, and that's why this strange sound. And we have several stages in the cough. Catarrhal stage, when we have catarrhal stage means that we have a runny nose, sore throat, so a common cold-like illness. And then paroxysmal stage starts when children start to cough, they even vomit, so this is quite severe case of type of cough. And stage 3 is recovery, then it lasts for a long time. So it's quite long-lasting disease, actually. And diagnosis based on clinical symptoms. Of course, we can use some diagnostic tests like PCR, or we can culture the bacteria. Nowadays, cases of whooping cough have decreased significantly because we have this vaccine, DTP, diphtheria, tetanus, pertussis, and it's given to children. But with the time, of course, this immunity wanes and some booster shot should be given. And we can treat infection using antibiotics, but when the paroxysmal stage starts, and treatment has no effect because the toxins have already released and it had already effect on our body. So if we start before paroxysmal stage, this treatment with erythromycin or macrolide, it has more effect. But they can reduce transmission, because this antibiotic treatment, even in paroxysmal coughing stage, because they kill bacteria. Okay, guys, let's finish this lecture at this point. And next week I will we'll go through some MCQs as well. Okay, we'll dedicate some time to MCQs as well.
Thank you, Doctor. If you don't mind.
Okay. Yes.
So firstly, just to understand, for the midterm next week, do we need to cover lectures 6 to 9, or do we need to include next week's lecture as well?
No, not next week's lecture.
Okay, so 6 to 9.
6 to 9, yes. But not including the parts that we didn't cover now. Yeah, not
Yeah,
including tuberculosis or some other slides that we couldn't go through. Okay,
no, of
so
course.
let's not include respiratory tract infections.
So
Okay,
this second half
just
of this lecture then.
yeah, first half, cardiovascular and lymphatic system, including this, and other chapters will be included in final. Okay.
Okay, so I'm just going to make a note. So basically, don't include from, I think it was like slide 25 onwards.
Yes, let me check. So 20, yeah, including the slide 19. Just first 19 slides from today's lecture.
Sure. And do we need to know like every single different type of vaccine for each disease?
And I will not ask a very detailed questions. The questions can be like this, for example, what disease is caused by some Corynebacterium diphtheria, in this case, is a respiratory tract. So, which virus can cause infectious mononucleosis, for example? Yeah, I will not go in much details, and asking about vaccines or yeah, there will be more general questions. As we have so huge material, I will try to make questions as simple as possible. Yeah, for you.
No, thank you. No, it is very in-depth chapters.
Yeah, chapters are huge and they are discussing more detail. Not very much details, but still it's too much to cover. I will not include parasitic infections. Yeah, let's exclude those. So I will cover in my questions the infectious agents that are mentioned in presentation. Yeah, not others. In textbooks, you can find other infectious diseases as well, other causative agents, but it's too much, I think. I'm trying to cover the major infectious agents in my presentation. Yeah.
Yeah, no, of course. And will you be able to upload this new presentation onto the drive today? If that's okay?
Yes. Just when we complete our meeting, then I will upload this presentation on Drive.
Okay, no, thank you so much. Appreciate all your support.
Thank you for attending. New textbook is also uploaded. New of Tortora's microbiology, so you can go through new version. Okay, thank you for waking up so early and joining this lecture. I was not alone in my lecture. And have a nice day and have a nice week. And hope to see you next week.
Thank you, you too.
Thank you, Maria.
Have a nice
Thank
day.
you, Risha. Bye-bye.
Bye.